right, so I'm going to move on to my last segment, and this one is one that I get questions about all the time, and is it do you need to worry about masses on your skin or soft tissue? So I get a few consults a month for skin lesions or what I call lumps and bumps, which are masses underneath the skin, and patients are always asking me, do I need to worry about this? Is this a problem? And I actually got the idea for this segment from an article in People magazine. Throw that article up, Trey, as I always do. I post the articles so you can read them if you want. I'll summarize it for you right now, though. Actress Janine Avanti, who's I actually haven't heard of, but there's a lot of actresses out there I haven't heard of. She's 51 years old. She felt a mass in her neck, and she went to, I guess, one of her primary care doctors, and they were like, well, you've had some lumps and bumps before, like, don't worry about this. And so she didn't really think about it too much. But then she went and got a consult for plastic surgery to get a facelift and neck lift, and the plastic surgeon felt this bump, and they're like, whoa, this doesn't seem right. So the plastic surgeon ended up taking it out herself, I believe, and it ended up being a pretty rare form of cancer.
Wow.
And so, yeah, that was kind of a close call. That's why this thing was in the news, is because, you know, she initially was told, oh, don't worry about this. And then the plastic surgeon's like, no, you need to, like, we need to take this out. And it ended up being cancer. And apparently she's going to be okay. And so that's kind of inspired me to talk about this topic about skin lesions and lumps and bumps, and, you know, do you need to do anything about them? Well, the majority of things on the skin and little lumps and bumps underneath the skin are benign. Do you know what I mean by benign?
No, I don't know what that is.
Okay, so when you're talking about cancers, there's, you know, cancer, or also called malignant, and then benign is not cancer.
Oh.
So if you have a bump that's benign, it means it's not a cancer bump.
That's good.
Does that make sense? Okay.
Yeah.
Yeah, okay, so benign. I want to make sure you knew that, Trey, right? Just from being on the show?
Mm-hmm. I did know that.
Okay, cool, all right.
I did know that.
All right. So I think if we're going to talk about these things, we do need to separate them into skin and then soft tissue, because they're a little bit different. So when it comes to skin, if you're a young person like Danica, or Trey too, I'd say you fall into that young category. You know, skin lesions are almost, not always, but almost always benign, meaning they're not cancers. When you get into middle age, like myself, or older people, like, you know, my parents, the rate of bumps or, you know, things on the skin being a cancer goes up dramatically, because, as you may or may not know, the older you get, the more sun damage you take, the more likely you are to get skin cancers. Which, you know, did you know that skin cancers are the most common cancer in the United States?
I didn't. I thought it would be breast cancer, honestly.
It is not. There's much. Breast cancer is number one cancer in women,
Yeah.
but skin cancer is number one overall. And a lot of times, when they talk about cancers and rankings, they leave skin cancer out, because outside of melanoma, most skin cancers are not super dangerous. I mean, they can be dangerous, but so a lot of times, you know, people will say, well, skin cancer is number one, but, you know, outside of skin cancer, like breast cancer is number one in women. You know?
Yeah.
So the types of skin cancers that you see most commonly, and there are other ones out there, but the three most common ones are basal cell, squamous cell, and melanoma. I got a picture, Trey, throw it up if you would. And I will say that skin cancers can look all kinds of different. These are kind of classic looking: basal cell carcinoma on the left, squamous cell in the middle, and melanoma on the right, but they don't always look like that. You know, basal cells and squamous cells can almost look like anything. In fact, it actually can be really hard to try to determine what something is by looking at it, because there's so many variations of what it can look like. Melanoma does typically look bad like that. It's the kind of dark, splotchy, just really kind of, you know, scary looking, I don't want to say moles, because they're not really moles, but like dark pigmented lesions. So when it comes to skin lesions, you know, the most common complaint you'll hear is, I got something that's changing on my skin, or it won't heal, or it bleeds, or it's very dark or erratic looking. And if that's the case, then they need to be taken off. You know, I have this mole on my cheek right here it's been the same for 50 years practically. I don't need to take that off. It's not changing. It doesn't look different. It's not growing. So that'd be a skin lesion where you're like, oh, this skin lesion's okay. But if this was changing, it was getting bigger, it started to look different, then it needs to go. Because even though most skin cancers are not overly dangerous, melanoma being the one exception, which is extremely dangerous, they can cause problems as they get bigger. So, my take on skin stuff, if you have something that's either growing or you have something that's changing, go get it looked at, and my recommendation is to get it removed. Like the first doctor that the actress saw that said, oh, this thing is probably not anything to worry about, I would have taken it out. And that was not a skin lesion, that was a deeper lesion, which we're going to talk about now, which is soft tissue. So do you know what I mean by soft tissue, Danica?
Like underneath the skin, like a different
Bam,
layer.
that is absolutely right. That's exactly right. So it's not something on the skin like my mole, it's something underneath my skin where the skin looks normal, but there's like a bump there. Absolutely right, good job. So soft tissue means below the skin, the subcutaneous fat. So when you're talking about subcutaneous or soft tissue lesions, they are almost always lipomas. 70 to 80% of soft tissue lesions that people go to the doctor for are lipomas. A lipoma is just a benign, which means what, Danica?
Non-cancerous.
Non-cancerous, very good. Fatty tumor. I got a picture of one. Trey, if you want to throw that up there. Yep, that's a lipoma. It kind of looks like fat, but it's more structured. Like fat in general is not very structured. It's kind of pulpy and kind of just doesn't have a shape. Lipomas have a shape. They feel like a much firmer piece of fat. They're painless, they're soft, they're mobile, they tend to be very slow growing. And when do you see a soft tissue lesion and think that maybe it's not a lipoma? Well, if there's rapid growth, if they're firm or fixed, or if they're painful, they have a large size, deep location, if it causes skin changes. Now, even though that almost all soft tissue masses are lipomas, when I see them, I do recommend that patients take them out because if they are lipoma, which is far and away the most common, they generally continue to grow and lipomas can get enormous. I've taken out lipomas this big, like I'm not kidding. They're as big as like a volleyball that people have had for 30 years and they just didn't do anything about. And the problem is even though they're benign, the bigger they get, the harder they are to get out, and the more invasive the surgery is to remove them. And eventually they will get big enough that you will want to take them out, not because they're cancer, because they just kind of get in the way, or maybe you look like a hunchback from Notre Dame with this thing on your back or whatever. And so eventually you're going to want to get it out, so it's best to get them out when they're small. And then there's always a chance it's not a lipoma. I mean, I've been fooled a couple times in my career where I looked at something, I was like, I think this is a lipoma, and I pulled it out and it was cancer. I think I've had that happen twice in 15 years. So it's not common, but it can happen. So yeah, that kind of summarizes, skin lesions and soft tissue lesions. My take is that if you have a skin lesion that you've had your whole life, it's not changing, you're probably safe to leave it. If it's a skin lesion that's changing, it needs to go. Soft tissue masses, I personally take them all out because eventually they're probably gonna have to come out, and they're better to come out when they're small. So yeah, I mean, and I actually do lots of these. People send me this stuff because they want the closures to be perfect. And so, they send them to a plastic surgeon. So.
Can I ask you this?
Yeah, absolutely.
Is there anything that you can do to stop those type of things from like popping up and happening? Like anything that you can do as far as like soft tissue and anything? Or
soft tissue, probably not. Yeah. Skin, yes. Okay. You can prevent skin cancer by using sunscreen, being in the shade. I think we've done a segment or two on skin cancer.
Absolutely.
So you absolutely can affect the rate at which you get skin cancer. But soft tissue masses, to my knowledge, and I'm pretty certain on this, there's nothing you can do. Yeah. It's just like, it's a group of cells, the fat cells, they get out of whack. Or even say if it's a cancer one, like liposarcoma or sarcoma or the soft tissue cancers, they're really pretty rare, but they can pop up. I mean, there's nothing. I think there may be a couple of risk factors for those things, but they're very obscure and it's not like something easy to do. It's like if you drink too much or smoke too much, you have a slight increased risk of getting soft tissue cancers,
Okay, that makes sense.
Yeah, that's a good question. I like that one. All right.